All right, thank you very much. My name is Bill McGahan, and it's awfully hard to see out here. Here comes Adolphus and Robert. I grew up here in Atlanta, and went off to work in New York in finance for a number of years, and then came back to Atlanta in 2006. About 2012, I got frustrated with the homeless that were living on the streets downtown, and after being involved in a bunch of other charitable efforts here in town, decided that I wanted to focus on that, and I wanted to solve that problem. So what I did is I started by educating myself about what we do well as a community in Atlanta and what we don't do so well. And what we do well is that principally one thing, which is that if you're a chronically homeless person who's living downtown and you need a meal and you're not drunk, high, or argumentative, that you can get one, mostly by the Christian-based missions who have been doing that for a long time. What we don't do well is we don't do a very good job of getting people who are chronically homeless, living on the streets downtown, out of that to self-sufficiency and being a productive citizen. So, so sort of with that assessment, I decided to start Georgia Works, which were based on my values for a homeless service provider. Homeless services is not like anything else in one respect, but in another respect, it's a lot like other things. And by that, I mean that there's horrible management in homeless services. The people who usually get into homeless services are have a lot of empathy for the people who are homeless, but they don't run cost-efficient, effective programs, and I wanted to change all that. So I started Georgia Works. Let's see if I can get this to work. All right, so in terms of the problem, there's approximately 6,000 people who are homeless in Atlanta on any particular night. There's a point in time count that's done every 2 years. About 4,500 of these, and this is kind of in the metro area, not in the city of Atlanta proper, are episodically homeless, which are basically poor people who have run into some problem, like the car broke down or they lost their job or something like that. But about 1,500 are chronically homeless. 30% or so has severe mental illness, and about 70% of them, or about 1,000 on any night, so that's not the number over the course of a year, but just on any particular night, are chronically homeless, able-bodied, mostly men who have bad habits and huge obstacles getting out of homelessness. So I started Georgia Works making sure that when a man comes into the program, they have to commit to being drug-free, drug and alcohol-free. They have to work 30 to 35 hours a week. They have to agree not to take handouts of any kind from the government, other enablers, which are sometimes people who think that they're doing them a favor who are not. They have to agree to save 20% of their income, and they have to pay their way by paying for room and board. Like I said, they have to work 30 hours a week. It's a work-based program, and if we pay them $7.40 an hour, that's $222 a week. They have to pay $100 out of that for room and board. We make them put $50 into savings, $72 into their pocket, and again, renouncing all public assistance. But when a man comes in, he's facing a lot of obstacles of getting out of homelessness. Guys who are downtown or, have no money, historical drug and alcohol programs, a long criminal record. Adolphus, who's going to come up here, has been arrested 100 times, about 100 times. One of our success stories. They have no identification or a prison-issued ID, maybe, which if you have a prison-issued ID, it's very difficult to get a job. Past due child support, wage garnishments, no bank account, poor formal education, lingering health issues. So if any of us who didn't have a core underlying problem had all of those obstacles, we would find it very difficult to get out of homelessness unless we worked on it for a long period of time. But in addition to that, they have some core underlying problem, usually an addiction or slight depression, or they've been abused of some way, physical or sexually, or they were a foster kid and they were passed around from family to family, poor role models. So we have to get to that core problem that underlies all of their obstacles so that when we get them out of homelessness, they don't return back. So what we do is we put them through a program which is a comprehensive 6 to 12-month program that works on them as human beings. We supply them transitional jobs and housing, but we also case manage them And we put them through classes, AA classes, life skills, financial management, career development, adult education, GED courses, et cetera. We do that over this time that they're in our program and they're working. So we have 100 men who are living in our facility downtown. Again, we started this program 2 years ago. I have 85 graduates. These are men with jobs, apartments, clean, and paying taxes. Now, these guys were living on the streets downtown and living outside on the cardboard. And so we've got 85 of them now who are, paying taxes and not on any government assistance whatsoever. Average starting wage is over $10 an hour. We've had a lot of other success stories, such as restoring their driving privileges. We've got 95% of our men in our program are reconciled with their children, because once you get that child support going, you can get back in their lives. We retain a lot of them, and we have thousands and thousands of past drug and alcohol tests. So what I've done is I don't rely upon any government programs ourselves, but I've started basically a staffing business within Georgia Works. And so what we do is we contract with private employers to hire us as a staffing company. We send our men out to work in essentially what are dirty jobs, recycling jobs, construction jobs, all those sorts of things. They contract with us, and our guys go off every day and go work at these private employers. So today we have about 55 men out of our 100 men who are working in these private businesses who pay us, and then we in turn pay them. That represents about $22,000 a week in revenues to us, which is about a run rate of about $1.1 million, which is over half of our budget that it costs us to pay our support staff. So we can get a man from chronic homelessness again for about $9,000, and it costs the state of Georgia about double that to incarcerate him. So it's a pretty good financial deal. Of our 85 graduates, about 85% of them are still clean and in their original jobs. So we're all over town. That's over at Virginia Highlands, working for their CID. And we pitch to employers that our guys will be eager and on time, drug and alcohol free, trained to do the job, and we'll get them there. We also provide the workers' comp insurance that we pay for, so it's a good value proposition for these employers. So when I started this program, that's an overview. Hopefully I did a pretty good job of describing that. It's hard to see your heads if you're nodding yes or you're puzzled from up here on the podium. But when I started this program, my wife asked me, she thinks I'm crazy normally, but she asked me whether or not, if we started a work-based program in Atlanta, do any of these guys who are on the street, do they want to work? I mean, maybe they're, a city of 5 to 7 million people. Maybe we've got 1,000 or 2 who just want to lie around downtown. And that's not the case at all. We have some providers who are enablers, who are low-barrier shelters, who allow people to act in destructive ways, but that's not what we're all about. We're about changing the behavior of the homeless person, because what they've been doing in the past has not been working. So we're about changing their habits to working, from a dependency mindset to self-sufficiency, and to addressing their problems head on, regardless of how painful they are to address. So I'm going to ask Adolphus to come up here to tell you a little bit about himself, and then I'll ask Robert to come on up. But they're just 2 of the 185 or so men that we have affected.
Thank you. First of all, I want to say thank you for having myself and Robert here to speak to you all, to let y'all know about the Georgia Works program. My story is like 2 parts. The first part of my story, as the chairman just described to you, was addiction, drug addiction, crime, and those type of things. Even at a young age, I made bad decisions about my life, and I continued to make bad decisions up until I'm 61, up until about the age of 58. The last few years before I came to Georgia Works, I decided to change my life. And due to the wreckage of my past, I couldn't get a job. After I got clean from drugs and alcohol, I wanted to work. I wanted to have a normal life. But it was hard because of the waste in the past. I couldn't find employment. I didn't have any money for housing. I couldn't take care of myself. And I was on the streets of Atlanta, homeless, on drugs, living from day to day, surviving from day to day. And when I decided to get clean and everything, I made a conscious decision to change the way I live. I went to rehab, and I learned how to deal with my disease on a daily basis, and I got clean. I couldn't find employment, though. And I heard about Georgia Works. Georgia Works was just opening up at that time, and it was almost like it was a godsend program for me. It offered everything I needed to get my life back on track. So I came there. I participated in the program to the fullest. I like to say I was like a sponge because I had a desire to live right, and it helped me. And after being there for a while, and we began to get more jobs and everything for the guys, I also found out that I had a passion. Not only did I want my life to change, I also wanted their life to change. And I think that the staff there seen that in me, so they decided to hire me and give me a job on their staff. And for the last year and a half, I've been paying my bills, going to work, helping other people, and those are the three goals that I had when I decided to change my life. And it's all been very, very fulfilling and wonderful. The feeling I have now about being able to pay my bills, being a responsible citizen, paying the taxes, just helping other people, all those things, I guess they're priceless for me, you know. And I owe the majority of my life right now, the way I'm living, the quality of my life, to this program. It's a wonderful, wonderful program. And I try to instill that in the guys that come in now, to let them know that they don't have to live on the streets, that they can come here and change their lives if you truly want to change. Georgia Works will help you change. Thank you.
It's a pleasure to be able to be here. He's my peer. My story is a little bit different. Everything comes from decisions. When I was a youngster, my decision was to be against the system, to be against what was right. It turned me into an addict. I ended up being a drug addict. For 15 years, a career, what took me to homelessness, living in the streets, not knowing what's going to happen next. I heard about Georgia Works. I didn't really know if it was going to be for me. I didn't really know if I was going to be able to adhere to the different lifestyle of trying to get back on the straight and narrow. Some things that you don't understand, you're afraid of. But I got in Georgia Works. And like I said, he was my peer. He allowed me to see that it can work. But you got to want to work on yourself. You got to want to do right and be right and get back to self-sufficient. I've been there 8 months, and now I'm at a very proficient job. I've been clean for some years. and I'm not living in the streets no more. So Georgia Works did a great deal for me. And it can do a great deal for anybody if you want to change yourself. You have to always want to change yourself. You can't change for nobody, and can't nobody want you to change. You have to be able to want to change for yourself, or you won't change. I live on 5 principles now: vision, hope, work ethics, humility, and all that rests on integrity. And my name is Robert Williams, and I'm a Georgia Works man.
I joke around with the staff a lot that we now have a bunch of homeless Republicans all downtown. Because it really is, it's difficult. It's really difficult when you've been on crack for a long time, or you've been on marijuana or alcohol, and you've got a past that you're ashamed of because you've been arrested a lot of times, to address all that and be honest about it and candid and deal with those problems, many of which you're ashamed of and you don't want to talk about. But that's what we do. And I'm convinced that we can end chronic homelessness in Atlanta, and we can do it with our values and with our principles by demanding men address those things and change. And I just have a lot of confidence. We've gone from 40 beds last December, and we're up to 100 men in the program, and we're going to continue to grow. And I think over the next few years that we can, my hope is that we run out of homeless men. That's my hope. So thank you all for your time, and appreciate it. We'll be, I guess, available for questions.